Hello, today the topic is position of the clinician during bracket placement. It is generally said that while placing brackets, orthodontist should maintain a single position at which he can see the teeth at right angle. Also, the head of the patient should not be moved again and again, as this is not comfortable for the patient. Before placing the brackets, the position of the dental unit should be properly adjusted. Usually a dental unit is adjusted between 140 degrees to 150. At this position, the clinician can easily see the brackets at right angle. This setting also helps to see axial position of some brackets from 12 o'clock position. The clinician position for bracket placement given here are for right-handed orthodontist. For left-handed orthodontist, similar positions would be used from the left side. Now, how to position upper and lower incisor brackets. For upper central and lateral incisors, the bracket should be placed with the bracket holder on the mesiodistal and vertical center of the tooth, with the clinician sitting at 8 o'clock position and the patient head tilted on his right side toward the clinician. After the bracket is placed, the height of the bracket is checked with bracket positioner. The patient head is mad straight and orthodontist check it from 9 o'clock positions, with the gauge at right angle to his vision. To check the mesiodistal and axial position of the bracket, the orthodontist moves to 12 o'clock position and place a diagnostic mouth mirror at the incisor edge to indirectly check the mesiodistal position of the bracket. This indirect vision also helps to correct the axial or long axis position of the bracket to some extent, but direct vision will give an excellent picture whether the wings of the bracket and the bracket scribe line is parallel to long axis of clinical crown. While checking axial inclination of maxillary lateral incisors, brackets, it is a good practice to tilt the head of the patient to opposite side. For right maxillary lateral, the patient head should be tilted toward left side and versa. The lower incisors brackets are placed in a similar fashion as upper incisors brackets. Vertical height is checked from 9 o'clock position, while 12 o'clock position is used to check to mesiodistal and axial position of brackets. Diagnostic mouth mirror can be placed gingival to the bracket to check mesiodistal position of the bracket. Some clinicians prefer to check mesiodistal and axial position of lower incisor bracket from 8 o'clock position under direct vision with patient's head tilted towards the orthodontist. Next is bracket positioning for upper and lower canines. Positioning of right upper and lower canines brackets is done at 9 o'clock position with the mesiodistal and axial placement checked from the same position. While the vertical height of the bracket is checked with gauge from 11 o'clock position. For left side upper and lower canines, the brackets are placed from 9 o'clock position with the patient head tilted toward right. The mesiodistal and axial positions of brackets are checked under direct vision from the same 9 o'clock position. 9 o'clock position. Then comes bracket positioning for upper and lower premolars. Upper right bicuspids brackets are placed at 9 o'clock positions, and its vertical height is checked with gauge from 11 o'clock position with patient's head slightly tilted toward left. Many a time, the cheek retractor hinders the correct positioning of the bracket positioning gauge. Check the mesiodistal position of the bracket from 11 or 12 o'clock position with diagnostic mirror using indirect vision. This vision also gives some hint about axial position of the bracket, but the correct axial position is checked from 9 o'clock position under direct vision with patient head tilted toward left. Right lower bicuspids brackets are placed on the tooth at 9 o'clock position. The vertical height is checked and adjusted from 11 o'clock position. The clinician check axial and mesiodistal position of the bracket at 10 o'clock position under direct vision. Some clinician can recheck the mesiodistal position of the bracket under indirect vision by placing diagnostic mirror on occlusal surface of bracket. Upper left bicuspids are placed at 9 o'clock position with the patient head tilted toward right. The mesiodistal position is checked under indirect vision with diagnostic mirror from 12 o'clock with the patient head tilted toward right. The 12 o'clock position also give a good view for axial position of bracket under indirect vision, but it's better to see axial position of bracket from 8 o'clock position under direct vision with the patient's head tilted toward right. Lower left bicuspid brackets are placed from 9 o'clock positions with the patient head tilted toward right. The mesiodistal and axial position of the brackets are confirmed at 8 o'clock position under direct vision. Thank you so much for watching.